Hello, I'm doing a video response on health equity. After watching the video, one of the questions I need to respond to was what experiences have you or someone you know had with health care inequality? I guess I can personally speak and say, speak on a personal experience where when I was 11 years old, I went into the hospital with my parents and I had appendix explosion. At the time, I didn't know, but now I know after they had to let me know that I needed surgery due to that. When I was in there, when I was sitting into the waiting room, they had me, they had some nurses come up to me and ask me questions that I felt like it was inappropriate. I was only 11 years old. I didn't know anything about what they were talking about. They came up to me and they had some assumptions where it wasn't any doctor based uh what is it called, like it wasn't the doctor based diagnosis. Like they asked me, oh, are you pregnant, right in front of my parents. And I just thought it was really inappropriate and unfair for somebody in a healthcare field to come up to me and ask me, like, is that the reason why I am feeling the way I'm feeling? And I was just in so much pain and I needed help immediately that it really felt to me that it was, inappropriate and unfair for me to be treated that way, especially as a child in need of care. The second question was, what healthcare inequalities do you see or know of in your community? Um, in my community, there's a lot of people that are addicted to drugs or need help getting off drugs. So, a lot of people go into the doctor to try to get some assistance, mostly because they are trying to get off or they need help because of the pain or probably don't have a place to stay. So I would say just knowing that they are treated very unfair due to the fact of where they are in life and not treating them like a regular people. I think that would explain the inequalities of that. What responsibility does the patient have in healthcare communications, healthcare employees? Well, I can really state the fact that they do ask the patients, like in the healthcare employees do want to know the symptoms that the patient is experiencing. So you do have that right to kind of explain how you're feeling, what hurts, what you don't agree with. So you get that right to be able to speak up for yourself in that. If you disagree with any medications or any treatments that you are offered by the healthcare employees. So I really do appreciate that. It's not like, where it's just all their saying and their actions where you would have to accept. So I would say I'm glad that the healthcare patients are able to be able to communicate with the employees and let them know how they feel about the treatment plan. Thank you.